Hello, my name is Sheila Cambin. I'm the president of the International 22q11.2 Foundation. I'm here today to talk to you a little bit about the syndrome and share with you a story that's very close to my heart about my son, who's now 10 years old. My son was born at a very well-known teaching hospital. He was born full term, but he was born urgently for severe growth restriction. I had an emergency C-section and he was transferred to the neonatal intensive care unit for thrombocytopenia of unknown origin, for hypoglycemia. He was noted to have low set ears and a sacral pit. No one recommended genetic testing. He stayed in the NICU for 9 days. After that time, he was discharged home at a weight of 411. He was unable to latch, yet no one ever bothered to examine his palate. Once he was home and began to grow, he was delayed on every single developmental milestone by at least 6 months. He finally walked at the age of 18 months. After that, we took him to an orthopedic surgeon who evaluated him for ligament laxity and hammer toes at the age of 2. That doctor looked at my child and thought he might have something called Ehlers-Danlos syndrome. He recommended we see a geneticist. We took Aiden to a metabolic geneticist at the world's best children's hospital, who looked at him and said, he doesn't have Ehlers-Danlos, but let's just get a cardiac echo when he turns 4 to be safe. Time marched on. Aiden was seeing full-time physical and occupational therapy, and we began to realize that he might have some kind of learning difference. His preschool teacher brought his father and I in for an emergency meeting and sat us down and gently explained that she'd been teaching preschool for 30 years and she thought that something was wrong with Aiden and that he needed to be evaluated. But by who? We chose a developmental pediatrician who's world-renowned, who spent 4 hours evaluating him. And at the end of the consultation, he looked at us and said, here's the autism spectrum, here's your child. I'm not sure what's going on with him, but I recommend you see 14 different specialists. After seeing 14 specialists, including PT, OT, back to genetics, speech, social skills evaluation, behavior therapy, Aiden's diagnosis came back as an incidental finding from a geneticist who said, we won't find anything on him, but we'll just send a microarray to be safe. Aiden has a submucous cleft palate that wasn't diagnosed until he was 5 years old. He requires intensive speech and articulation therapy. What I left out of this story till now is that besides the 27 clinical specialists that my son saw before his diagnosis, both of his parents are physicians. Physicians who practice at major academic institutions in a metropolitan area. His father is an ear, nose, and throat surgeon, a very bright and accomplished ENT who did not realize that his son had velopharyngeal insufficiency. Furthermore, I'm an obstetrician who delivers some of the sickest babies in the world, and to this day, I am confident that I could not reliably make this diagnosis in the delivery room. I am confident that Aiden would remain undiagnosed today if he had not been evaluated at CHOP or had parents with the tenacity to keep pushing for evaluations. Prenatal screening and testing would have prevented this diagnostic odyssey, and prenatal diagnosis would have given Aiden the chance for early interventions and therapies which could have substantially improved his outcome. If I had known about this diagnosis when I was pregnant with him, I'm not sure what choices I would have made, but I can tell you that I can look any person straight in the eye today and say that my son, who's here now, has changed my life in the most wonderful ways that are indescribable, that if I could go back in time and change that decision, there's not one fiber of my being that would do anything different. He's the most incredible little boy. He's very playful. He's bright. He's affectionate. He's a joy. And the struggles that he has brought such perspective to my world. It has made me such a dedicated mother, and it has forced me to make decisions in my own life that I know I would have never made for the better. And I cannot imagine my life for 1 minute without this very beautiful little boy.